If you're in nursing school, a PA program, or pursuing a public health degree, the federal government just changed how much you can borrow to pay for it. Here's exactly what changed and what it means for you. Before July 2026, graduate students in almost any field could borrow up to the full cost of attendance through the Grad PLUS loan program. That program has now been eliminated for new borrowers. In its place, the law creates two tiers. Professional degree programs, like medicine and law, get $50,000 per year, up to $200,000 lifetime. All other graduate programs, including nursing, PA, PT, and public health, get $20,500 per year, up to $100,000 total. The change takes effect July 1st, 2026. Here's what this means in practice. A nurse practitioner student whose program costs $35,000 a year would face a $14,500 annual gap between what federal loans now cover and what their program costs. Over a 2-year program, that's a $29,000 shortfall they'd need to fill with private loans, personal savings, or scholarships. The Department of Education defined which programs qualify for the higher cap. Medicine, dentistry, law, optometry, pharmacy, and a few others made the list. Nursing didn't. PA programs didn't. Physical therapy, occupational therapy, public health, social work, none of them. These are the providers who staff rural hospitals, community health centers, and the communities where physician access is scarce. Supporters of the new limits argue that the old system, unlimited Grad PLUS borrowing, created perverse incentives. When students can borrow unlimited amounts, institutions face no pressure to control tuition costs. The Department of Education notes that 95% of nursing students borrow below the new annual cap, meaning most students wouldn't be directly affected. Critics, including the American Nurses Association, the American Hospital Association, and healthcare advocates, argue that the 5% of nursing students who do borrow above the cap are disproportionately those pursuing advanced practice roles. Nurse practitioners, nurse anesthetists, and others who provide primary care in underserved communities. PRNs provide anesthesia in 70% of rural hospitals. Over half of U.S. counties have no obstetric physician. PRNs fill that gap. For students from first-generation, immigrant, and low-income backgrounds, the stakes are especially high. These students are less likely to have family savings, less likely to have employer tuition support, and most dependent on federal loans. Private loans, the only fallback when federal aid runs out, carry higher interest rates, fewer income protections, and no path to forgiveness for public service work. Here's what to do right now. Check whether your specific program is classified as professional under the proposed rule. Your institution should be communicating this. If your program is affected, start mapping your funding gap now. Before July 2026, apply for every mission-aligned scholarship you qualify for. And if your field is among those excluded, consider submitting a public comment when the proposed rule opens. Applications for the Daisy Family Foundation Scholarship are now open. If you're a first generation immigrant or underrepresented student pursuing a healthcare career, this scholarship exists for you. Link in the description. And if this was helpful, subscribe. We publish new content on healthcare equity and student resources every week.